Here we'll talk about Ebstein's anomaly. It is the inferior displacement of tricuspid valve. In the picture you can see on the right side there is tricuspid valve which is displaced inferiorly. When you compare it with the mitral valve on the left side, so this tricuspid valve is displaced inferiorly, right? So this is the main reason for this Ebstein's anomaly. And also there will be malformation of this tricuspid valve. Usually this tricuspid valve has three leaflets. One is anterior, posterior and the septal. So out of these three, this posterior and the septal are usually involved in this malformation of tricuspid valve, which will lead to inferior displacement of this valve. What happens if there is inferior displacement? As you can see in the picture, there will be enlarged right atrium and the very small right ventricle, right? So this leads to atrialization of the ventricles. Right ventricle is not developed properly, making the right atrium dilated. So the right atrium is very enlarged or dilated, whereas this right ventricle is underdeveloped. So what happens if the right ventricle is underdeveloped? There will be less blood going to the lungs for purification. What happens if there is less blood going to the lungs for purification? The body will receive less oxygenated blood, which will lead to cyanosis. So the baby presents with cyanosis. As a less amount of blood is going to the lungs, it will lead to cyanosis. And the risk factors include lithium exposure. It is very important to remember. Inferior displacement of tricuspid valve, lithium exposure, and also other specific thing which you can see in Ebstein's anomaly is box-shaped heart on the X-rays. In the picture you can see the right atrium is so much enlarged that even in the entire X-ray you can see heart, which is like box-shaped heart, right? So just remember these things. So in the findings on the X-ray you can see box-shaped heart because of the enlarged right atrium. That means because of the atrialization of the right ventricle. On the clinical examination, again cyanosis can be seen because this poor underdeveloped right ventricle is not efficiently pumping the blood to the lungs, which will lead to cyanosis. And S1 split can be heard in auscultation. So you don't have to remember this, just try to understand it. So normally what happens when you auscultate heart sounds, the first sound is S1, right? And the second sound is S2. So in the S1 you just hear lup, right? So it is a mixture of two sounds. One is M1 and T1 closure. So usually this gap between M1 and T1 closure, M1 is basically mitral valve, T1 is tricuspid valve. The gap between mitral and the tricuspid closure is less than 40 milliseconds. But what happens in case of Ebstein's anomaly? The gap is greater than 40 milliseconds. So that is why you can also hear split in S1 sound. Coming to the complications, you can see Wolff-Parkinson-White syndrome, which is WPW syndrome. There will be accessory pathways formed between right atrium and the right ventricle. These accessory pathways are known as bundle of Kent in case of this WPW syndrome. So what will be happening in this syndrome? There will be tachycardia, palpitations, shortness of breath and all. And the three things which you have to remember with respect to ECG is this decreased PR interval, delta wave can be seen, and wide QRS complex. These are the symptoms of WPW syndrome. And other complications include heart failure because the right ventricle is unable to pump the blood properly, and paradoxical embolism, endocarditis, tricuspid regurgitation and all. And the surgery which is done in case of Ebstein's anomaly is cone surgery. So what are the things you have to remember? One is inferior displacement of tricuspid valve, which will lead to dilated right atrium. That is why it is called as box-shaped heart. That means atrialization of ventricles. Clear? And then the risk factors are lithium exposure in the mother, and also box-shaped heart can be seen, right? And WPW is associated with this Ebstein's anomaly. And the surgery you do for this box-shaped heart is cone surgery. So this is about Ebstein's anomaly. Bye.